The Elder Services Provider Council is a networking group of senior care professionals here in our community who are committed to supporting each other and supporting the seniors and their caregivers here in the Frederick community. You may know us best of all from our annual Elder Expo and Caregiver Conference that we usually hold in October at the fairgrounds. Obviously, unfortunately, we had to cancel those events this year because of the pandemic. And instead, we've gone to this virtual digital format to continue to try and provide information and resources to you while you're at home. We're actually intending to continue the webinar series indefinitely. We're planned through the end of December and are already looking ahead to new ideas for the new year. I'd like to thank those of you who have made suggestions when you registered. You've got some great topic ideas, and we're excited to bring that to life for you. We are new to this technology, just like you are, and most of the world. We're all learning together how to make it work. Last month went off pretty successfully. I apologize in advance if we have technical issues here. I hope you'll stick with us, come back next month. If you yourself are having technical issues and finding this difficult to navigate, I urge you to sign up for our free Zoom training. Special thanks to the Frederick County Senior Services Division for offering that free training, and especially to Dara Markowitz at the Frederick Senior Center. Dara's done a great job helping people get up to speed with Zoom. So if you register next month, you'll have an opportunity to click that button that you're interested in Zoom training, and Dara will be in touch with you. A few things about our Zoom webinar. We can neither see you nor hear you, so feel free to get comfortable. Don't worry about background noise. You will communicate with us via the chat and the Q&A buttons, and you should find those at the bottom of your screen. If you don't see them and you hover your mouse, they should come alive. We'll ask you to use the chat to let us know if there's a technical issue, if you've lost sound or something with the screen. I can't see you or hear you. I also can't see what you're seeing. So if something's wonky, please use that chat feature to let us know. We ask that you use the Q&A button to type us your questions. And those can be questions for our speaker or general senior care questions. I should point out I have a great crew of co-hosts who are hidden behind the screen who are monitoring that chat and that Q&A, reading your questions. Sometimes they'll respond directly to you. Otherwise, we'll hold those questions for our speaker at the end of the presentation. So again, use that Q&A button to ask questions and the chat button just to let us know if something's going on. Before we get started and jump into our presentation, I'd like to do a quick poll. Mageen, if you could pull up our first question. I'm interested to know a little bit about your experience with telehealth. So first question, before March of this year, before the pandemic, have you ever had a virtual telehealth experience? So use your mouse, you can click on the answer to that question. We'll see how many folks have voted so far. So pretty overwhelmingly, most of us had not had virtual health experiences before the pandemic, and probably few of us even knew it was a thing. I'm interested now, Mageen, if you want to put up our second question. Since March of this year, is it working? So we can, So since March of this year, have you had a virtual or telehealth visit? You or the person that you're taking care of? How many of you have actually done a telehealth visit? So definitely way more now than there were before. I'm guessing if you're here tonight, you probably think those visits could have gone a little bit better, or you'd like to learn some ideas to make the most of this telehealth experience. I personally hope that telehealth sticks around. I know for a lot of the caregivers that I talk to, being able to communicate with a doctor from the comfort of home without having to load somebody with mobility or memory issues into a car has been a little bit easier. So hopefully we will all have the opportunity to continue to use this technology, and hopefully after tonight, we'll all use it a little bit better. I'm really excited to introduce our speaker tonight. Alex Nason is joining us. Alex is the Director of IT Innovation at Frederick Health. Alex has more than 30 years of healthcare experience in research, policy, clinical, academic, and consulting environments. He's a healthcare executive with a passion and innovative approaches to care delivery within a complex healthcare system. Alex has championed the development of innovative clinical services utilizing telehealth and digital technologies for over 20 years. Alex is helping Frederick Health chart its own course in innovation by directing a team that's implementing digital solutions across the enterprise. Prior to joining Frederick Health, Alex worked at Johns Hopkins Health System, the National Institutes of Health, and the White House. So Alex definitely comes with some great credentials behind him, and I'll tell you some wonderful enthusiasm. So I am very happy to welcome Alex, and hopefully I can get Alex up here on the screen. So give me a second.
I lost your audio.
Okay, Alex, if you can help get yourself on the screen,
Sure.
Are you able to change that?
Let me see. Yes, here we go.
Perfect.
All right,
All
how
right.
about now?
Yes.
Great. And I'll start the presentation. Are we looking good?
We are looking good.
Fantastic. Am I looking good? I guess it's well, thank you. Thank you very much for the introduction, and thank you to the entire committee for inviting me to present about telemedicine and digital health, e-health, and these various solutions. I've been in this space for over 20 years. It's been a true passion of mine. I actually have a presentation from 2003, and it listed reasons for telemedicine, and slide 27 and bullet number 6 actually said global pandemic. So it was something that I've been actually championing for a very long time. For a moment in time like today, I wish it didn't have to happen this way, but it's sort of one of these things where I'm very proud of the initial work myself and other pioneers that have worked on this for a long time, or having an opportunity to really show that telemedicine is something that is safe, effective, and can really make a great impact in our challenging healthcare environment. So really a great opportunity here. Let's see, first slide, oops. Oh, there we go. So this concept around telemedicine has been around for a very, very long time. This was a magazine cover from 1924 that talked about the radio doctor, and this idea that there was a doctor on this radio, not even TV, that was going to reach through and look down a patient's throat. You know, and so this idea around Star Trek and what we've been talking about for a very long time is really, you know, coming to fruition now. And really today, the new face of healthcare are so many of these digital companies that are out there. And while traditionally healthcare has been thought of as our hospitals, our community hospitals, our community physicians, now they're being supported and augmented and enhanced through many of these technologies, whether they're technologies that are direct to the consumer, something that you can buy and bring home, whether it's something that is of convenience. So for example, like PillPack, which is actually owned by Amazon, which can now actually deliver to you all your medications organized by day in a way that is much easier to navigate and order very easily, to some of the cardiac care devices. Down at the bottom there for AliveCore, for example. This is a device that you can purchase yourself, connect to your iPhone, and get a FDA approved EKG done. And that EKG could be sent to your physician along the way. So really this impact of these technologies has really transformed what our healthcare environment looks like today. So today I'll talk a little bit about some of the trends in our healthcare environment. It's good to understand some of the background of sort of how we got here. Some of the foundational tools around telemedicine The role of the digital caregiver, and I think of each one of you on this call today, learning a little bit more about what's my role in playing in this digital space, and then tell you a little about just what we're doing at Frederick Health and our digital journey, and then what I think is really important, the digital imperative of overall healthcare. Again, no surprise to what we've been talking about for a very long time, and these are conversations that happen both at the hospital level, at the policy level, state governments, local governments, national governments, insurance industry. We know we have an aging population. We know we have a sicker population. We know we have a population that is remaining older longer thanks to the interventions and what we now know through our technology and medications. We have a greater expectation of care. I think given these advances, we're looking for solutions to our healthcare challenges that we find. We know that there's a physician shortage in this country, and there's also a poor distribution of healthcare providers in this country. And the funding of healthcare has really either remained unchanged or it goes down depending on sort of which side you're looking at. But the day of the blank check of I will deliver healthcare and there will be reimbursement has sort of changed much. In fact, healthcare providers are now motivated to actually keep people healthier and you might say, well, of course they are. But in actuality, the financial sector of healthcare has actually driven the activities of healthcare, whereas now we're being driven a bit more by some of the more positive outcomes, which I think is a great benefit. And technology adoption, I think, is on the increase, both for the patients as well as the providers. Although I would say up until recently, technology has been kind of a slow adopter in healthcare, one of the more behind the times sectors, I would say. And as I was saying, technology adoption being slow for physicians, I think number one, the EMR experience, the electronic medical record, is something that I think any physician would probably, very few physicians would say that it's been a positive experience. It's been a lot of technology that's been thrown upon them that they've been asked to participate with. And it never goes well, but it's something that has been, that they've been really, really pushed into to providing better outcomes by using these electronic medical records. Hospitals are challenged with HIPAA, the information protection, and some of those limitations. So even though the technologies allows the ease of this to share information, hospitals are also, and physicians as well, are required to protect that information at a very, very high level, which is an investment, which doesn't make it that easy to share. And the patients, I think, as early adopters, if they're willing to look for it, if they're looking for it, then they're going to see the ability to participate with it. And so have they been the early adopters starting to push the envelope on this? I think truth of the matter is all this has been accelerated tremendously because of COVID-19. I have been talking about this for over 20 years. I've been a passionate speaker about this around the world for 20 years. And truly, it's been the past 6 months that everything has really been elevated and moved to the next level because of the challenges that we're facing with the pandemic. So a few foundational pieces of information about telemedicine. And I share these not to confuse you and not to, not that there's a quiz at the end, but I want everybody to understand that we don't, in the healthcare industry, look at telemedicine as being something that is just 2 cameras, a doctor and a patient, and let's just go do that, right? There's a lot of thought that goes into these tools. It gets to be very confusing as well because you'll hear terms of virtual care, telemedicine, telehealth, e-health. Then also you have your wellness apps, for example. As I look at it, telehealth is the big umbrella of all of this. It includes not just the clinical applications, but it includes education, it includes research, it includes health administration. So when I was at Johns Hopkins, for example, we had our telehealth program, which was really having the CEOs of all the hospitals and the leadership of the hospitals being engaged remotely in order to remove all the travel back and forth. That would fall under a telehealth umbrella. The telemedicine is that clinical exchange between patient and provider or provider and provider. And virtual care is really focused down on the individual encounter. They blend together. If someone said, I have a telemedicine visit, I have a telehealth visit, or I have a virtual care visit, it's pretty much, they can be very much interchanged. And I think it's important to recognize that the spectrum is very broad. It can be everything from simple text messaging and reminders and health reminders that can come over text message, excuse me, to real, what I call data exchange, that ability for an individual to send a picture, to take a picture even with their mobile phone and transmit it to their doctor to show, let's say, a wound or maybe a rash, to that idea of a telepresence, which is a little bit more around the e-visits and the appointment, which is, I think, what many of us are starting to see happen a little bit more. Then we get into the remote monitoring, and I'll talk about the Frederick program in a little bit also, but this is around real-time information flow from patients back to a provider in order to make decision. And then we've even gone to the point of telesurgery. And while I was at Johns Hopkins, I worked on a program with a Dr. Lou Cavusi, who was actually involved on manipulating a robot, which was inside a patient at Johns Hopkins, and Dr. Cavusi was a couple miles away at his office, and he was able to do the procedure. This was a proof of concept around that distance. We then furthered that in a partnership with the Department of Defense and did something between actually Johns Hopkins and a hospital in France, and showed some of the telesurgery there. So you can sort of see where that progression is. And obviously, as you get further down the line, it becomes more technology heavy, more complex, as well as sort of understanding what that workflow is. But telemedicine really hits us in many, many different ways. 3 types of telemedicine that I think is important to just share in case it'll come up in conversation and discussion with your provider. Asynchronous telemedicine is a live interaction with your physician. So it's a real-time face-to-face. It's a communication. It's like having a natural conversation with someone. It requires a higher bandwidth. It requires some good bandwidth in order to have that good audio and video communication. And again, there's no perceived delay in that access to care. So it could be, again, real time in an office visit. It could be between 2 physicians talking about a situation, about a patient. So it's a real-time live communication. So that's synchronous telemedicine. Asynchronous telemedicine, which actually, if you looked at all telemedicine happening in the world right now, the majority of telemedicine that happens is asynchronous, meaning images, information is captured, it's recorded, it's documented, it is sent to a remote individual, physician, let's say. That individual on their own, when they have availability, whatever their schedule might be, will review this information. They'll make a judgment on that information. They will report on that information, and then they will send a result back. So very much in the pathology, radiology, which are very, very, very high utilizers of this type of service of asynchronous telemedicine. Dermatology is another one. Because truly, if you have real-time live images, your dermatologist doesn't necessarily have to see you. Just as long as they can understand the background, the history, and that skin rash or that skin situation, they can give you results back. Lower bandwidth requirements. This can be done through something like an email exchange, etc. But it's more of a low bandwidth situation. Actually, at Frederick Health, one of our programs is primarily asynchronous, and that's actually for low acuity primary care. So often rashes, tick bites, sunburns, even a UTI, for example, those are often things through a series of questions, and then potentially any kind of images. Our providers are able to make a consult without actually a live interaction with that patient. And then mobile is a little different, and I only bring this up because mobile, in some situations, might be live synchronous information. So I mentioned earlier around the EKG through that Alive Core platform. Actually, the Apple Health Watch is actually FDA approved now for capturing EKGs as well. But it's capturing that information and transmitting it to the far side pretty quickly in a synchronous live format is very possible, as well as asynchronous through mobile devices. So we talked about text messaging earlier, SMS messaging. That would be considered asynchronous. Or let's say you took a picture with your phone and then you transmitted that as well to your provider. That would be considered asynchronous. So the mobile environment provides both synchronous and asynchronous. A lot of the disease management programs, a lot of the ongoing chronic programs are often in this sort of mobile combination of synchronous and asynchronous as well, through a combination of some interactions, live interactions with, let's say, an app, mixed in with some remote review of that information. So mobile is sort of a blended approach to this. And again, I think it's important for everyone to just understand that while it might seem on the outside that it's about patients and providers and maybe the equipment you have and the connectivity and the location of where you might be providing these types of services from, behind the scenes, folks like myself really focus on the operational workflow. How do we fit in a virtual visit at the same time that we're still running in our offices as well? So how does that fit into the physician's or the provider's schedule? What does the clinical workflow look like? So for example, when does the medical assistant get on the video, record some information? You know, think about what happens in an office visit. When you walk in, someone might take your weight, someone might take your vitals, they'll document that. Someone will take you to a room, maybe a nurse might come in, capture some more information, document all of that. Then maybe the physician comes in. Same kind of thing with telemedicine. We think about the clinical workflow a lot. Care coordination is really important. And then there's a few other things. IT support. You know, you'd be very surprised the amount of support that we want to ensure on the back end to making sure that both our providers as well as our patients are successful in connecting. So there's a lot that goes into making sure that there's a successful telehealth encounter. And one thing that I think goes also on behind the scenes is some of the things that are happening at the legislative sessions. I actually spent time in February in Annapolis talking about several telehealth bills for the state of Maryland that are important. And several years ago, I testified on some work around payment and reimbursement, fighting for the opportunity for providers to bill for telemedicine. Historically, that hasn't happened up until about maybe 5-7 years ago. Now they can. Additionally, I was fighting most recently in Annapolis for helping define the definition of telemedicine in the standard of care. A lot of folks were trying to put technical requirements to it, and I was really there with many other providers talking about the standard of care. If the standard of care allows me to deliver this care and I can achieve the standard of care through asynchronous telemedicine, then why not? Why should regulations require me to have a live video session, for example? So it's just important to know that everybody here understand that you know, successful telemedicine is it's a bit technical, it's a bit of the workflow, it's a bit operational, it's a whole lot of care, and it's also making sure that our policies and regulations also support it as well. Many opportunities for telemedicine. So provider to patient, the office visits, which I think many of us are familiar with. Provider to patient and the family member. So given situation with the pandemic, allowing, you know, a lot of people are now not necessarily able to go to a visit with family anymore. or the ability now to bring in other family that might be spread out regionally, maybe not be able to travel for an office visit with a family member for whatever reason. The ability to have a provider visit with both a patient as well as a family member is a great opportunity for telemedicine. Provider to provider telemedicine, we have this a lot. When I was at Johns Hopkins, being their center of excellence, our providers there were asked to consult with many providers and provide a second opinion. Actually, at Frederick Health, in our neonatal ICU, we actually send cardiac reads to Johns Hopkins and to Children's Hospital in DC for a second opinion review on a reading there for that. So that provider to provider relationship. And then facility to facility. So some of the activity that we're trying to work with around some of the skilled nursing facilities in our communities, trying to help make decisions prior to residents being transferred to the hospital. Let's have a consult remotely first before we get there. And so to making sure that that is actually necessary, instead of trying to move a resident to a hospital for an evaluation, only to find out that that patient is dehydrated, only to then return back just a few hours later and save the stress and the anxiety, as well as the cost of that transfer. The visits, I think, in the acute care space really show a lot of opportunity with telemedicine. And I just put this here to show that if we looked at the total number of visits that come to the emergency department, to an urgent care center, and to a walk-in clinic. So I'm not even talking about office visits. I'm talking about that walk-in environment. If we took all of that combined and we put that in, there's a huge opportunity there to really help reduce that number through telemedicine. And in fact, exactly what I mentioned earlier, what we're trying to do in our urgent care environment is provide these services via telemedicine to these patients. And again, telemedicine addressing some of the real world problems in healthcare, and a few things that I'll mention here. In the acute care response, so many hospitals don't have access to a neurologist for stroke management. Frederick Health does have a very strong stroke program, but there are many hospitals that don't have a neurologist available 24/7, 365 for stroke. And so these hospitals will often outsource this stroke response via telemedicine to a physician who is board certified, who is licensed in the state, who is privileged at that hospital, and who has expertise in not just stroke management, but doing that over telemedicine. So that allows for that ability, those services to be done locally. Chronic disease management, I talked about earlier with some of our remote patient monitoring programs, and I'll talk a little about that towards the end here. Some areas of physician shortages. So many parts of the country, we don't have many psychiatrists available to patients in the hospital or in our community, as well as intensivists for the ICU. And then global issues. And to be honest, I have not updated this list anytime recently. I've always talked about things like a pandemic and SARS, but telemedicine has been used in situations of earthquake and disaster response and hurricane response. It's been impacted for bioterrorism situations, as well as impacting some of the global economics of the inability to travel around the world to seek care. As a side note, there was a period of time, many years ago, there was a awful earthquake in Haiti, and the island was pretty much without for actually almost 2 years. The #1 hospital in Haiti was actually the University of Miami, and that was all done via telemedicine. So it really shows that through innovation and through need, you can really deliver a lot of services via telemedicine. Just one other thing to comment on as well. We take very seriously in the hospitals, and healthcare does, from a security and safety point of view, licensing. So we need to make sure that your provider is licensed in the state that you're sitting in. So again, you might say, oh, why can't I talk to that doctor who is in Illinois? actually it depends on where you're sitting. So if the patient is sitting in the state of Maryland, that physician needs to be licensed in the state of Maryland. This protects you, this protects the physician, this ensures that that physician is passes the standards of care that the state of Maryland requires. Additionally, at the hospital, we need to credential all of our providers within the hospital to provide this care. So for example, I talked about what we do with the NICU and those physicians at Johns Hopkins and the Children's Hospital. They're all credentialed at our hospital. But I comment here just around some of the outdated hospital policies, just because things like, for example, we require every physician to have a TB shot. Well, if a physician's never coming in the building, why do we require this? So these are some of the little things that I work on with our staff and our hospitals that talk about some of the advances when we think about using technology. So to the digital caregiver and each one of you, the digital caregiver really is that individual that acts as the hands and the eyes for a patient. And what's so important about that, and why that's so important, is that it really helps facilitate this examination. It ensures that information is flowing, that it's efficient, that it's accurate. The digital care provider is with the patient there, and they assist both the patient as well as acts as a proxy for the provider. So in many cases, for example, the digital care provider is that individual who might assist with and document a blood pressure to then communicate that to the physician, might ask, the physician might ask the provider to, the physician might ask the digital caregiver to help with maybe an examination, with the ability of let me see the patient stand up, and you might be asked to help that patient stand up, and certain things like that. So they play a very important role in ensuring that what we want to do over video, what we want to do live in a telemedicine environment, that we want to capture the right information, gets transmitted appropriately. And it's something that really has been not really thought about in the past, but one that I think is more and more important. What may be required of the digital care provider? So again, first and foremost, a patient advocate. The digital care provider is there to help ensure that there's a very smooth telemedicine visit, that it goes well both from a technical point of view, and making sure that the connection goes through, that the audio goes through, the video goes through, as well as supporting the entire clinical engagement itself. Some of the characteristics of a good digital care giver there that I've outlined below: assist with the physical examination, like I mentioned, be a strong communicator, be that advocate for the patient. Be relatively comfortable with the technology. You don't have to be an expert, but just be comfortable with the technology. Be flexible and adaptive to the situation. There are times where the provider might not have a good video connection, or they might have to switch from audio. Maybe your audio might not be working, so this audio might have to go to the phone. And the digital care provider might have to be flexible in that situation and be adaptable to sort of what the technology is sort of giving us at that moment. I like to put in there a willingness to learn, because again, these technologies are relatively new for most. And then I always say the ability to remain calm. We're there to keep the things, as a digital caregiver, we're there to keep the conversation moving forward. We're trying to keep the office visit happening, the telemedicine visit happening, and we're there to help keep everybody calm through this process. I took a few minutes and outlined some of the things that I think are really key for a quality telemedicine visit, and it starts with some of the technology, and first and foremost, before your office visit there. Take a moment, test your equipment before you start. Myself and the organizers got together here 15 minutes before the conference started to test audio and to make sure that things were working appropriately. do the same thing. Take a few moments, make sure that your volume is on, make sure that your camera and microphone are working correctly. And many of the technologies that are available to you today, as you're using them, will give you that ability to do a sort of a pre-test in advance of the event. If this is a regular occurrence with your provider, if, let's say, this is going to happen on a weekly basis, make an investment into a decent webcam. Today I'm traveling, so I'm doing this off my laptop webcam. There are nicer webcams that give you better quality image, and they're only 30 bucks or less. If this is going to be part of the regular occurrence, then it makes sense to invest in something like this. Set up the camera at eye level. This will be easier to maintain contact with everybody. Audio is just as important as video. In fact, in some situations, audio might even be more important. If you've been able to transmit all the information and now you just need to be able to speak with your provider, audio might be more important than just the video. And again, depending on the environment, you might want to spend a few dollars on a headset and microphone, or in your situation as a digital caregiver, a decent little microphone pod might be good. So there's an easy way for both you as well as the patient hear what's being said to you by the provider. Adjust the lighting in the space. Lighting is always key to make it a good quality event of the video. So overhead lights turned on, backlights should be turned off, things like that. Whenever possible, a wired connection is always better than a wireless connection. Wireless connection can come and go, but a wired connection is definitely the most robust, particularly in some environments today where there might be not only the telehealth event trying to be happening, the office visit trying to happen. You also have children at home who are trying to do their online schools. You might have others at home trying to also get online at the same time for, let's say, for their own work. So there's a lot of things going on with the wireless. So being wired is always a good thing. It's a simple thing. Plug your computer in if you can. Particularly if you're on a mobile device for live power, because the last thing you want is for the battery to go dead in the middle of a telemedicine visit. Find a quiet space. This always helps, makes it distraction-free. If given the opportunity, share clinical information before the encounter. If there's the opportunity to upload the latest vital information, to upload a picture of a rash or a wound or any type of clinical background prior to the virtual visit, it will help the provider be prepared before the visit, as well as make the whole entire appointment more efficient. Then you're not needing to support the conversation with the patient and starting from scratch over video there. And I think it's really important, just like you would before leaving a provider's office, have a list of questions, things that you want to make sure that you've addressed during your visit, and feel comfortable in asking those questions before the end of that video visit. And the nice thing about it is that you can jot this down, you can keep a little sheet off to the side, and it's not intrusive to the conversation. It's not something you need to bring out with you necessarily in the middle where you might not feel comfortable with, but this gives you the ability to take notes and really keep track to making sure that all of your questions are answered. So a few takeaways here. So we have many challenges in healthcare. Telemedicine is just sort of one part of the answer. And I mention again, very little about the technology because technology is not telemedicine. Really, it's about the workflow and it's about the providers on the other end. And we all still need good providers on the other end to interpret and take in that information. Healthcare needs solutions, and what I mean by that is these solutions, the technology's been around for a long time, but how we implement them in healthcare and how they become a solution to what we're trying to solve for really is what we're looking for. Healthcare has never been simple. It never will be simple. We're just hoping to make it a little less complicated. And the final bullet there around, while the technology and interaction is different, the key clinical guidelines to apply to a telemedicine visit remains the same. It goes to that standard of care. And your provider will be working through the technology in order to maintain that standard of care. And if a provider isn't comfortable and isn't feeling like he or she is able to achieve that standard of care, then they will say so. And they will actually then make sure that you are seen in person and in an alternative way. So it's really important to recognize that, that providers have an obligation to really make sure that their standard of care is being achieved through this technology. And if it's not, they're gonna say so. And it's no harm to it's nothing that you've done wrong or the patient's done wrong. It's really about that provider making sure that what they need to get done is appropriate and makes sense to achieving that standard of care. I didn't go into too much about the technical issues, but one thing that I do want to say is that these technologies that we're using today, from my perspective, ones that are being led by the hospital, the ones that are being led by the health system, meet standards around information security, information safety. We take these things very, very seriously. While the pandemic has opened up the ability to do things over FaceTime, for example, and some of the more consumer-friendly types of ways of doing things, that will all pull back in the healthcare environment, and making sure that these technologies are meeting security standards so that all the information remains private and you can feel comfortable that the information that you're sharing with your provider is one that is being in a secured area. Last few minutes here, I'll just talk a little bit about at Frederick Health, our journey here. Our focus has really been on innovating and reimagining and re-envisioning how healthcare delivery system will look like for our patients and our consumers moving forward. We've been on this journey for almost 2 years now, so it wasn't just because of COVID. Our ability to connect and support our consumers in their decision-making process and trying to engage with them. And how do we elevate and how do we bring the brand of Frederick Health and the information that we have of sharing to our entire community. And those are some of the principles behind some of the things that we're doing with our digital health environment. And as I mentioned, my team that I lead of the IT innovation team focuses on patient experience, population health, clinical outcomes, total cost of care, and patient safety. And 3 programs I just want to highlight. Number 1 is our virtual visits. So today, you can go online, you can go to frederickhealth.org, and you can go to our virtual visits page. And if you have a condition, a low acuity condition, so as I mentioned earlier, if you have seasonal allergies, you have a rash, you have a tick bite, you have a UTI, pink eye, that's another big one we see a lot. You can go online, put in your information there, and then through there, you're able to share that information and then get a consult back and a result back in 1 hour. This is all being supported by the immediate care providers and doctors that are both at our urgent care environment, both at the Toll House as well as down in Urbana. Our remote patient monitoring program, and you all might be involved in supporting this with some patients in our community. But today, our remote patient monitoring program allows us to give equipment to patients in our community and monitor them. We give each one a scale, a blood pressure cuff, a pulse oximetry, as well as a tablet. They go home with this device, and every day they get on the scale, and they get on the scale. They take this information, they take their blood pressure, and they're able to transmit that back, and there's a nurse that's watching all this happen. That all happens not necessarily in real time, but it all happens every single day, and it gives our nurses the ability to monitor patients and to see who is staying within protocol and who might not be. And a final program that we're working on right now is the ability for our personal health records. So today, it's very challenging for patients to keep track of their various patient portals and all their information. We at Frederick Health are now participating with Apple Health and the Apple Health app. So now if you're a patient at Frederick Health and you have a Meditech portal, through your Meditech portal, you can connect it to your Apple Health portal. And so if you happen to also be a patient at Johns Hopkins or at a LifeBridge hospital who also participate in this, you can get all of your medical records into one single comprehensive view. Couple final slides. I just want to talk about the overall digital healthcare journey. As I mentioned earlier, it's a little bit, for us, we're focusing on how do we help our patients discover? So how do we help them find information and discover where they need to go for care? How do they actually do that care? Meaning, how do we do with online scheduling, online registration, and actually having that appointment, as we've just discussed today? And then how do we continue to engage through staying connected through healthcare applications? And these are some of the things that we continue to focus on. And healthcare today is moving very quickly into trying to be virtual, but also personalized and very transformative in how we deliver care. And I always like to end this with this slide. This is called the technology hype cycle, which I think is very important here. And this can be applied to many, many different things. But we start with our technology trigger. So we say, oh, the Apple, the Apple iPad is going to revolutionize healthcare. So therefore, it's the technologies, the Apple iPad. The statement that comes out is this: it's going to revolutionize healthcare. So that's your peak of inflated expectations. Then you quickly drop down into the trough of disillusionment. I can honestly say telemedicine has been in this trough of disillusionment for a very long time, up until the past 6 months. And we are now going through this slope of enlightenment, this ability to get to something that is a bit more regular, having these aha moments and hitting that sort of that plateau of productivity. So I'll stop here. I know I talked a lot. I hope you found it helpful and informational, and happy to answer any questions if anything's come up.
Fantastic. Alex, thank you so much. If you have questions for Alex, you can use that Q&A button at the bottom of it might be at the top of your screen, but you can type your questions to us for Alex there. We've got a couple that have come in already, Alex. So is telehealth safe? Can it get hacked? Can someone listen in?
So a telehealth platform, a good telehealth platform, and ones that we at the hospital and ones that we provide to our providers and our physicians, are ones that we really focus on that meet these standards, these IT security standards, so that they can't be hacked. And we take a lot of precautions, right? Every single link that you get, for example, as a patient, should be a unique link. It shouldn't be the same link every single week. And the same thing goes that it should not be shared with others. So I want to say no, but if some providers are using things that are a bit more on the consumer side, like a FaceTime, things like that, that's where I get a little bit more nervous, because those tools were not necessarily designed for the healthcare environment there.
Excellent. How about, so are doctors and providers using the same telehealth app so they can communicate with each other?
Not necessarily. In some cases, so for example, I'll give here at Frederick Health, we actually use a secure text messaging application within our health system. So our providers can message one another. It's secure. It's not simple text messaging. It's actually a specific platform designed just for this need. So it gives them the ability to be on the same platform here. It also gives them the ability to share this information with an outsider through a secure way. So again, we do take these tools that we're using for sharing of information to be secure. However, we're not requiring everyone to be on the same platform. These platforms should be able to invite and allow the collaboration for those providers within the system, as well as those providers outside the system when appropriate.
Excellent. Alex, how about personally? Is it dangerous for us to keep a health app with our complete medical record on our phone?
So what's really neat about this Apple Health app is that it brings the information onto the phone when you request information on the phone. So you're not really holding it on the phone. And if the phone was ever to be stolen, if the phone was ever to be in someone else's hands, there's security that's involved already to get into the phone, but it also gets wiped off there as well. So it doesn't stay connected all the time. It's sort of, in essence, making these connections up to making sure that there's a live connection there, but it doesn't really hold it onto the phone there. But like everything, if you take a picture of a rash and you send that off, that picture is on your phone, so you want to be careful with that information as well.
Alex, I was interested when you talked about bringing in family. I know, as you said, people aren't able to travel. Caregivers often rely on siblings or other family members to be part of conversations. Does the caregiver need to ask the doctor, can we make that happen? How does somebody facilitate or start that conversation?
Yeah, great point. Yes, I think the caregiver would be a real appropriate person to making that ask to the provider, whether it's, do you mind, can we share this link with a family member and have them participate? Or possibly at the end of our visit today, can we send a link out and have a sibling dial in for the last 10 minutes of our visit here, for example. So I do think that's appropriate for the caregiver to ask. I think it's appropriate way to kind of facilitate that as well. And also, you don't want to surprise the physician with Brady Bunch on the screen and the whole family's getting together for a get together. It's not time for a family reunion per se.
Excellent. And do the offices require a release, or do they have to sign documents to let other people in?
Yeah, it's been, the HIPAA documentation and sharing of who else can participate in something like this is something that providers should. It helps cover them. It makes them feel a bit more comfortable around, is there authorization for others to participate here. You want to, the provider will probably say to the caregiver and or the patient, is it okay if we invite, your sibling into this conversation? And so there should be at least a verbal yes, which then gets documented in that conversation.
So Alex, another question just came through. Do you think telehealth is here to stay now that so many are using it? And will doctors and insurance companies be more ready and willing to use it going forward?
So I think it will be here to stay. I think whether it's the same percentage as it has been in the past, clearly when COVID first impacted us, we went to everything to virtual. I don't think it will be everything to virtual, but I do think we'll see a good percentage that are appropriate that should be done virtually, and which makes a lot of sense. I'll give you a perfect example. One of our orthopedic surgeons who does a lot of hips, he's like, great, I see the patient the first time. I don't need to see them over and over again in my office. I could see them on video. I can ask them how they're doing. I could ask them to stand up. I could ask them to walk. I can watch them walk, and that's perfectly fine. There's no need for them to come in. And it's easier for that patient who has to be uncomfortable in traveling in, who might have to coordinate other support in order to make that visit as well. So I think those are here to stay. And I think now we've been able to quickly demonstrate how much either patients like it, how much family members like this. And so I think patients will also start to say, hey, doc, can we do this over video?
And is that an okay question for a person to ask the office?
I think so. I think especially now, because if the physician did not adapt over the past 6 months, they sort of missed the boat a little bit. So hopefully they've been adaptable and they've been able to make this shift a bit and to make it part of their medical toolkit.
Excellent. We've got a few more questions. I know we're pushing the hour, but these are great questions, everybody. Thank you. Alex, are there efforts underway to help communities that don't have good internet access?
So it's interesting, yeah. So I think the two biggest industries that have been shaken up, and I say this also because my wife is a teacher. And so both education and healthcare have been truly shaken up by this pandemic more than anything that anyone's ever done. Two industries that have been so based on archaic workflow and process. I think we now recognize how important communication is, how important internet is, making sure that there's accessibility to internet, and what that means, again, not just from I want to watch Netflix, but beyond that to what does it mean to accessing healthcare, to accessing education. And I do think going forward that there's going to be much more efforts into increasing internet accessibility in a way that historically has not been really pushed upon. So I think you're right.
Excellent. So one last question. Is there any measurement being done? Was Frederick Health using the virtual stuff before? Is anybody doing any qualitative analysis about whether these virtual visits are helping in the senior population in particular is the question?
Yeah, so a couple things. So it's been too early to tell around some of the outcomes there, but we're very much participating in research, looking at our outcomes, looking at our data. There's really, I look at two ways of looking at this. The patient satisfaction outcomes, I think, are extremely important to making sure that the patients are staying engaged in their healthcare and they're part of this, healthcare services needs. And we're finding that patients have been actually very satisfied for the most part. I mean, I think once we sort of get over the technical hurdles, we have found that the quality of the experience has been very positive for many. We're now probably going to be starting to spend a little bit of time understanding if there are any adverse outcomes that may have happened through telemedicine. We sort of dipped our toe into it and maybe we jumped 2 feet into it, but whether we went head first is a different story. So I think we're going to really be looking at the outcomes and starting to recognize whether it's a quality experience, quality outcomes, safety measures, making sure that physicians have been documenting things appropriately, making sure that patients are getting the outcomes necessary as well, and gain that information, because again, it's a little bit different, and we want to make sure that not too much is being lost in communication just because of the technology.
Excellent. Well, I think that does wrap up our questions and wraps up our presentation. Thank you so much. Alex actually joined us tonight remotely from vacation, so proving the value of technology. Alex, thank you so much for your time, your energy. And as I said, I know some of the caregivers I talk to, these virtual visits have really been helpful. So I hope that they continue.
One final statement, and I know we're talking about the role of the virtual caregiver. I also want to make, and being somebody who spends a lot of time being a caregiver also, telemedicine is also for you all. And it's something that to make sure, because I know it might be hard for the caregiver to get away to take care of themselves. So remember, telemedicine's there for you as well. And while you might say, hey, I can't leave because I'm here to take care of my loved one, or my responsibility is to take care of the loved one first and foremost, make sure telemedicine is there also for yourself, to make sure that you're taking care of yourself, because if you're not taking care of yourself, forget about it.
Alex, that is a great point. And we know that the job all of you do as caregivers is difficult in the best of times. The pandemic has certainly made even more challenges, but really, you're it. And if you're not available and you're not your whole self, it's going to be challenging for your loved one. So it is important that you take care of yourself, whether it's telehealth, mental health, take advantage of those resources.
Absolutely.
Alex, again, thank you so much for joining us. All of you who are visiting with us tonight, so glad that you could be here. Our next presentation is October 8th, Thursday, October 8th. Our topic is navigating loss and life changes. And loss isn't really necessarily death. We're all facing so many changes and losses, from the weekly coffee clutch with your girlfriends to losing your connections, your respite care. All of those things are impacting you, all of us. So we've got a great speaker from hospice who's going to spend the hour with us, helping us give some strategies to get through that, to get through all of that. So join us. You'll need to register again. The same way, I think we have Mageen, if you have that slide, we can pop it up with the link. But we look forward to seeing you. Again, everybody, thank you so much.
Bye-bye, everyone.
Okay, guys, we are clear.
Did you stop recording?
Yep.
Great.
Thank you.
Let me stop sharing.